It is 2:55. We will resume meeting after the break. We'll now move into rulemaking policy discussion etiquette, rules and development, and rulemaking policy discussion with Staff Member Davis. And before we get started, we'll review a couple of policy etiquette points. Thereafter, we'll enter with package C9 followed by package C8. Again, when speaking into the microphone, board and staff, please identify yourself as board or staff with your last name. Please speak one at a time and directly into the microphone, and it's critical for public record. I recommend maximum of 6 inches away from your mic if possible. For each policy discussion, Staff Member Davis, or rather, I will be facilitating a roll call to poll the board members for their input. Once called on, it's your turn to speak and provide your opinion or comment on the policy being discussed. Comments will be limited to 3 minutes per board member. If you do not have anything to add to the discussion, it's okay to pass when called on. Should an unplanned policy discussion organically arise on a different topic, board staff will complete the current roll call and begin a new one on the new topic. To begin with, does Staff Member Davis have any comments with regards to rules and development?
I can make a quick comment on that, sure. I think a lot of it's going to depend on the strategic planning meeting, but what I primarily have in my docket for future discussion is the facility rules. So manufacturers, wholesale distributors, DDAs and 3PLs to align with the new DSCSA laws that come into effect this November, but they won't take enforcement, they've said, for a year. So I'm going to be primarily working on updating those, and then also continuing the process of rewriting 41 and separating out RP and IP.
You have a question about rules and development. If I can put a pin in that, and I'll ask that question tomorrow.
Okay.
With regards to then moving on to package number C9, I pass it over to Staff Member Davis to orient us, please.
All right, thank you. For those on the phone, this is mailing C9. Today is the board's 7th review of this rule. We've been talking about it for about a year. So today the board will again consider sending the proposed rules to the November 2023 rulemaking hearing to potentially adopt in December and be effective with all the other new licensee rules on March 1st, 2024. The language that's in yellow that's on the mailing shows what we have changed since it was sent to the September rulemaking hearing. So at the August board meeting, the board discussed this rule after they had received public comment in July. And the board provided direction that they intended for central fill and remote processing locations to be included in the exception for out-of-state pharmacists who are at registered drug outlets, and that they would be permitted to practice on Oregon patients without being licensed in Oregon. The board staff drafted revisions in real time, so we did it during the meeting. And then we sent this through rulemaking, and upon further internal discussion, we actually believe that additional clarification is needed on that exception. So in 855.115.0001, paren 3, the first change that I'm going to point out is really minor. We just said an out-of-state licensed drug outlet pharmacy, and that should have been an out-of-state registered drug outlet pharmacy, since pharmacies are registered and not licensed. And now I'm going to just read the whole rule so that it makes sense with the second, with the additional language about the exception. So a pharmacist who is located in another state and who engages in the practice of pharmacy for a patient drug outlet, or healthcare facility in Oregon must be licensed by the board in accordance with the following rules, except that a pharmacist located in another state who is working for an out-of-state registered drug outlet pharmacy who only performs the professional task of interpretation, evaluation, DUR, counseling, and verification is not required to be licensed by the board unless they are the pharmacist in charge. This exception applies only when a pharmacist is dispensing, delivering, or distributing drugs into Oregon from a registered drug outlet. A pharmacist who is providing other pharmacy services into Oregon must be licensed in Oregon. So the new language that's highlighted in yellow at the end is to clarify that exception that's in the first sentence. Staff believe it is needed as it is common for pharmacists to practice pharmacy separate from a drug outlet. As you may recall, with the rewrite of the pharmacist licensee rules, the board has ensured that a pharmacist can practice pharmacy separate from an outlet and that the rules were clear about what is required in that circumstance. The exception to licensure in the state was only contemplated in relation to a drug outlet and was not intended to apply to pharmacists who are practicing pharmacy separate from a drug outlet. Staff believe this change aligns with board direction for registered pharmacy locations where a pharmacist is dispensing, delivering, or distributing drugs from these locations are not required to be Oregon licensed, but the outlet must be an Oregon registered pharmacy and have an Oregon licensed PIC. Back to you, President Doyle, for discussion.
Thank you. Going for a round robin with regards to comments on these changes in the applicability. And if I may start with Board Member Vipperman.
Member Vipperman, I am in agreement with this, with these the new language. I appreciate the new language. It spells out exactly what I intended.
Member Hemmings, I would hold comment until I hear what everyone else has to say.
Member Patel.
Board Member Patel, I am in agreement, but then with the added portion, right, the newer portion, it says the exception applies only when a pharmacist is dispensing, delivering, or distributing drugs into Oregon from a registered drug outlet, right? So that means, how about the counseling? So if you're going to provide counseling, then you have to be registered in the with Oregon Board of Pharmacy.
This is staff member Davis. I can totally understand your confusion because we're talking about exceptions to the exception, right? So remember, a pharmacist located in another state who's working for an out-of-state registered drug outlet pharmacy who's only doing one of the options is counseling is not required to be licensed. And so the additional is just saying you have to be in a registered drug outlet. Like if you have nothing to do with a registered drug outlet and you're somehow calling patients to counsel them on medication, you would have to be licensed with us. You're only exempted if you're working for a drug outlet.
Okay. Thank you.
Member Doyle, my understanding is that you're in approval of the language change.
I think I'm going to pass right now. I have to read probably another 2-3 times.
Board Member Beeman.
Board Member Beeman, I appreciate the clarification, and I do like the addition because I believe that was our intent. Was not, yeah, I think it clarifies the intent much better. Thank you.
Board Member Doyle speaking. I appreciate the background and the rationale that was provided by staff member Davis. It aligns with what I recall, and it's good that this is specifically outlined that those exceptions relate to only the persons working in a registered drug outlet. I have in the past voiced my disagreement that that persons out of state conducting DUR and counseling do not need to be licensed in Oregon. I still believe that pharmacists providing those services out of state do need to be licensed, but understanding that that's not the consensus of the board, I would be approving the changes that have been highlighted in yellow for us. Virgin,
Friction is in agreement with the ability back.
member Hall,
Board member Hall, I pass.
board member Joyce.
Board Member Joyce, I support the comment. It is clear the differentiation. Also, it reflects a lot of the public comments that we got to make the distinction between what we accept as out of state, what was acceptable as far as out of state licensing, and what's not. I do have a question on the word, and this is not yellow, so this should have been asked earlier, but verification, because we talk about counseling, DUR, and verification. What specifically is that?
Staff member Davis, we have a definition for verification. Just give me a second to pull it up. It's in OAR 855-006-0005. And verification means the confirmation by a pharmacist of the correctness, exactness, accuracy, and completeness of the acts, task, or functions performed by an intern, a certified organ pharmacy technician, or pharmacy technician.
Okay, so the verification is not part of the dispensing, delivering, or distributing drugs. That's the exception. And we're requiring that to be to have an Oregon license, but we're not requiring the counseling, verification, DUR. So I was a little confused about the verification being there if it's not part of the dispensing process. So I guess it's not part of the dispensing process. Is that clear?
Remembered oil is part of the dispensing process, the assessment and production of a drug in a vial with label as it's sent out the door.
So verification. Yeah, I mean, as far as what's yellow and what's highlighted, it's clear, and it again supports what the feedback that we got from stakeholders, and it's
board member Higgins, coming back to you.
No comment.
Board member Patel, any additional information you'd like to provide?
No, I think this makes sense, and I'm in agreement with this.
Board member Paul, you had taken a pass before. I wasn't sure if that meant for good pass or.
Oh, yes, I have.
All right, thank you. Staff member Davis, I believe we reached a conclusion of the conversation with regard to this. Having consulted with staff in the room previously, my understanding is that we're going to hold off and making all motions until tomorrow. And so we can move on if you agree to package C8.
Okay. For rule mailing C8, give me just a second to get my notes open. Today is going to be the board's 6th review of OAR 855-125-0150. And today the board will consider sending proposed rules to the November 2023 rulemaking hearing to potentially adopt in December and be effective with the new licensee rules on March 1st, 2024. Again, the highlighted language shows proposed modifications since the rule was sent to the September 2023 rulemaking hearing. As a reminder, you may remember at the August board meeting, the board made real-time edits to this rule prior to motioning to send the rule to rulemaking. One of those real-time edits was to strike the phrase, so you wouldn't have seen it in the rulemaking filing. To receive, each certified organ pharmacy technician and pharmacy technician must not receive or provide a new or transferred prescription orally. After further thought and consideration, board staff identified that removal of this prohibition when it comes to controlled substances is in conflict with federal law. In 21 CFR 1306.03, the section on persons entitled to issue prescriptions, paren B states a prescription issued by an individual practitioner may be communicated to a pharmacist by an employee or agent of the individual practitioner. In 21 CFR 1306.21, this is requirements for a prescription. In paren A, it says a pharmacist may dispense directly a controlled substance listed in schedules 3, 4, or 5 that is a prescription drug as determined under section 503B of the Federal Food, Drug, and Cosmetic Act, only pursuant to either a paper prescription signed by a practitioner, a facsimile signed paper prescription transmitted by the practitioner or the practitioner's agent to the pharmacy, an electronic prescription that meets the requirements of this part and part 1311 of this chapter, or, and here's the important part, an oral prescription made by an individual practitioner and promptly reduced to writing by the pharmacist containing all information required in 1306.05. And then it ends with, except for the signature of the practitioner, because when you're doing oral, you're not going to have a signature. Also in 21 CFR 1306.25, transfer between pharmacies of prescription information for Schedule 3, 4, and 5 controlled substances for refill purposes. In paren B1, it says that transfers are subject to the following requirements. The transfer must be communicated directly between 2 licensed pharmacists. In 21 CFR 1300.01, definitions relating to controlled substances, the DEA defines a pharmacist as any pharmacist licensed by a state to dispense controlled substances and shall include any other person, for example, a pharmacist intern authorized by the state to dispense controlled substances under the supervision of a pharmacist licensed by the state. Again, also in ORS 689.005, paren 31, the practice of pharmacy means the compounding, dispensing, and labeling of drugs or devices, except labeling by a manufacturer, packer, distributor of non-prescription drugs and commercially packaged legend drugs and devices. So only a pharmacist or an intern under the pharmacist's supervision can practice pharmacy. A technician can only assist in the practice. Thus, board staff recommend adding back the prohibition that we had struck in paren N, but making it specific to controlled substances only. And with that, I will hand it back to Board President Doyle.
Board Member Doyle, my understanding is that specifically we're to address the new para M, but as we are considering this whole rule to be moving forward to rulemaking hearing, and comments on the rest of the rule are available as well. So I will rotate to Board Member Hemmons. Any initial comments, please?
Comment.
Member Patel.
Well, It's the 15, line 59, right? That's what you're saying, just the 15, okay.
That's that's what Staff Member Davis just spent several minutes explaining the reason why it had to be added in, but as we're sending this whole rule package potentially to rulemaking hearing, comments on other text is allowed as well.
Yeah, I'm fine with it because anyway, it's also come under DEA law, so we are doing that anyway, so doesn't matter, I guess. But we can put it there.
Remember Beeman?
Board Member Beeman, I'm very comfortable with it. I appreciate the clarity.
That's me. Next. I had a question about a question about the language in para M. My understanding is that that is it correct understanding that it's a new prescription period, no matter what type of prescription it is, and then it's a transferred prescription if it's a controlled substance? Or does controlled substance, go ahead, Steph, Member Davis.
Controlled substance applies to both. It's a new prescription for a controlled substance or a transferred prescription for a controlled substance.
Board Member Doyle, pharmacy technicians are not allowed to receive new prescriptions over the phone.
Staff Member
And-
Davis, at the August board meeting, the board determined the consensus was that they would be able to do that going forward, and that's why it had been removed for the rulemaking.
See. No further questions at this time. I'll pass to Board Member Chin.
Board Member Chin, I guess, I think what I might be picking up a little bit about the confusion, when you say receive new, or if you took out provide transfer prescription, you could read receive new. Never mind. The word provide in there, receive new, or provide transfer prescription.
It should say or provide a transferred prescription. I thought I had made that modification.
Is that so? The word provide needs to be there, just receive a new or transferred prescription for a controlled substance. Or
Member Doyle, I think the provide is also outgoing as well as incoming.
okay. Thank you. So the A would be helpful, but yes, I'm okay with the language, and I'm okay with the whole prohibited practice section.
Member Hall.
Member Hall, no comment.
Board Member Joyce.
Board Member Joyce, so you are specifically just talking about line M? Okay, okay. All right, well, I'll do line M first. I agree to that, that's fine. As far as new controlled substance or transferred prescription controlled substance, is that correct word that's prohibited?
It's the intended language.
Right, so new controlled substance or transferred controlled substance. And I'm in agreement with that. The other items on the prohibited practice section,
It's not right.
ETCB does have a certification for technicians to conduct MPM. I know that that scares some people, but it's there. And it can be done without requiring a pharmacy technician to use judgment. There's a lot of information that can be gathered by the pharmacy technician that does not require clinical or professional judgment. Such as with MTM, you can look at a patient's refill history, compliance with medications, and those are all things that are can be gathered by a technician without the use of judgment. It's clearly documentation of a lot of it of both subjective and objective information from patients and from pharmacies. So there are, like I said, PTCB, the Pharmacy Tech Certification Board, offers certification for technicians. However, here in Oregon, we prohibit it as a prohibit pharmacy techs from conducting or even assisting with medication therapy management. So I think it can be done without by technicians, again, without the use of any judgment. That's a comment. Also, when it comes to delegating tasks to other healthcare providers, I think under the supervision of a pharmacist, that can also be done. I can imagine some scenarios where a technician delegate tasks under the supervision of a pharmacist. So I don't know if we need to add language there. And also just in line 39, just the word, do we just want to say judgment? Do we want to clarify it and say clinical judgment, professional judgment? So those are my comments. Specifically on 47, though, I want to kind of touch base on MTM, because like I said, it's done by pharmacy technicians across the country. There are certifications for it. Pharmacy technicians are helping for even conducting full MTMs, maybe not to the level of pharmacist level, but they're assisting with the process. So to completely, so maybe we need to clarify that. Just to say they can assist or, without using judgment MTMs.
Staff member Davis, I can respond a little bit to that. So a couple of things, both of the things you highlighted, the MTM and the delegation, are both the practice of pharmacy as defined in 689.005, paren 31. Paren J says patient care services, including medication therapy management and comprehensive medication review. And then O, which it doesn't show on our website yet, but if you dig in, it's one of those laws that just hasn't shown up yet, is the delegation to other healthcare providers. It's a new statute that hasn't made it online yet. So in respect with paren G, it's prohibiting conducting the medication therapy management, and we do have a definition in our rules in 006.005 about MTM, and it means a distinct service or group of services that's intended to optimize therapeutic outcomes for individual patients. MTM services are independent of, but can occur in conjunction with the provision of a medication product. This is
Sorry.
not a scene of pharmacy.
Staff member Davis, can you hear us? We got completely kicked out of Teams, so we're gonna have to start over wherever you left off, if you were wondering why we were silent.
No, I didn't know you were silent. I just thought you were listening.
So sorry. Wait, go ahead.
Member Doyle, she was just about to begin an explanation to board member Joyce's question about MTM, and she was describing that MTM is defined as the practice of pharmacy and
Okay.
Yeah.
You got that.
Yeah.
Okay. So all this prohibition is on conducting MTM, which according to Merriam-Webster is to direct or take part in the operation or management of, to direct the performance of, or to lead from a position of command, which is what we look at when we're defining rules. This is not assisting a pharmacist in obtaining a medication list for a patient or gathering other information necessary to conduct MTM, but the pharmacist, it is the practice of pharmacy for a pharmacist to actually conduct the MTM.
So as board member Joyce, so, an MTM, requires, only a pharmacist can complete an MTM. Is that accurate to say?
It's the practice of pharmacy, and only a pharmacist can practice pharmacy.
Yeah, okay. I was just curious as to the Pharmacy Tech Certification Board's certification programs for technicians to conduct MTMs, but I do not know the level, the extent of the MTM that they can do, obviously, but it's just something that was also brought up in comments that, and I do know technicians complete this certification program to conduct MTMs, but again, I don't know the extent of it. Yeah, that's all.
Member Doyle, my understanding of Staff Member Davis's explanation is that technicians would be able to assist in data gathering for the actual event of MTM that a pharmacist must do. And it quite possibly other states would have different statutes that would allow pharmacy technicians to do more or less of the MTM. But as it's considered a practice of pharmacy in Oregon, we have our limitations in allowing technicians to do full review of MTM, even if those training programs do offer that type of training.
Okay, yeah, statute driven, I guess, yeah. Excellent. All right.
Member Vipperman, 3 minutes.
Three. Okay, I got three. Okay, so, thank you for that. Question though, board member Joyce, when you said, that I immediately thought, oh, well, you know, if we had a higher level of, a technician license, like an advanced, technician license, I could see where that would be a benefit, but I now hearing, the explanation, I understand. So moving on, I have a couple of things, as long as we're open to this rule. My first one is, on line 34. So it says that we are not allowed to evaluate, interpret a prescription. I would like clarification for this for the public. What do you think we do when we take a prescription in data entry?
Transcribing.
All right.
Remember Doyle, transcribing.
Okay, that, so that's what that means, is transcribing the prescription into the, computer.
That's the initial word that comes to mind, that you're reproducing an electronic version, if you will, of the data that is on the prescription.
Or handwritten.
Right hand, yeah.
Okay, and I agree with that. I just want to make sure that that is, public, how the public sees it. And so that's question one. Okay, so on line 34, want to make sure, okay, so my next one was for, line 59, which is the one that we have, changed. I like adding the for the controlled substance. I was not in favor of this rule in the beginning, so, okay. And then the next one is the delegation of tasks to a healthcare provider. What scenario would that be like? I ask for public so that we can say in public, what scenario would a technician delegate tasks to a healthcare provider.
This is Staff Member Davis. I pulled up the statute. Like I said, it's not online yet. It's in this little box up top if you click on laws from 2022. The practice of pharmacy includes the delegation of tasks to other healthcare providers who are appropriately trained and authorized to perform the delegated task. So it's the practice of pharmacy. It's not the assistance in the practice of pharmacy. Only a pharmacist would be able to delegate to another healthcare provider. The easiest situation I can think of is potentially like immunizations to a nurse who's another healthcare provider who's appropriately trained to perform the delegated task.
We just say the.
I know this is getting into the woods, but so if a technician came and said, okay, this is your, this is who you need to immunize next, we're not allowed to do that? Technician
not-
brings the paperwork. I just want to make sure that that's not what we're not saying that a technician can't do. Here's the paperwork. It's, now you go and do that. That's. Make sure.
Who is the technician telling to go do that?
Nurse.
Only the pharmacist can delegate.
Board Member Patel, I think what you are saying in this scenario, you just say delegation to me is like you just say, you know, nurse practitioner, go ahead and do whatever you want to do. I'm not going to supervise you. I trust you, you do the protocol. But what you are saying is like giving a task, not sort of delegation. It's a task that, hey, we done this process, this prescription. Now it's your turn to give immunization. So that's what it is giving the task. Delegation is like me delegating tasks to nurse to immunization. That means I'm not going to supervise that nurse versus, let's say, if I'm going to give that task to technician, then I'm going to supervise. It's not delegation. If that makes sense. There's no supervision when you delegate the task.
Okay. So when she talks, it's not on my 3 minutes, right? Listen, I got 3 minutes. Dude, okay,
Everybody's minutes are on everybody's minutes.
okay.
Like 3 minutes now, something.
Okay, so that does not, I don't think that answers my question. The question I want to make sure is that, you're in a scenario where you're working with nurses and I'm a technician and I'm doing a whole bunch of immunization reports and I'm handing it and I'm like, okay, first you do him, him and him. That's not a delegation.
Oh, that is not delegation.
That's a that's just asking, assisting. Is that what we consider assisting, correct? Because we're not talking about my pharmacist, we're talking about a healthcare person. That's what I was a little put off by healthcare provider. I mean, that was my point. Okay, I'm gonna go on because I'm on a time. Okay, so the next, my next question is, and I said this at the last one, I'm gonna say it again because I have the opportunity. I am concerned about the supervision, direction, and control of another licensee in the practice and assisting in the pharmacy. I'm concerned that we are not putting in here a little exclusion for supervising technician. This is going to be a barrier if it is not spoken to in the public forum, you know, of what this means. I mean, I go to my supervisor and for them not to have, for them not to allow a supervisor to be a technician and supervise, that's going to bring a whole new a whole new problem for pharmacists because they're gonna have to take care of it and they don't wanna do that.
Remember Doyle, I believe that you're talking about a manager subordinate relationship and that a supervision of another technician over you generally has to do with behavior or human resource issues and or creating a schedule. It's not the direct practice of pharmacy. And when I read this, it's supervise, control, or direct or control licensee in the practice of pharmacy. That's so there's a difference because I don't believe that you're providing an example that includes the practice of pharmacy. And if I'm mistaken, then I would ask somebody to correct me.
Staff member Shama. Board member Vipperman, I think you said when they don't allow, I think they is you, actually. Because this is the board's rule. So I think staff member Doyle was correct though in his estimation there that this is supervising another technician while they're assisting in the practice of pharmacy, which can only be done by a pharmacist. So the supervisory subordinate relationship is not included in this rule.
Okay,
Yeah.
and you know, I just wanted to make sure that we were clear on this because there was a question about it. And that this is not going to impede the way things are right now. So, okay, and hang on. Okay,
I'm saying, I'm supporting you.
thank you. Okay, okay, and I think that's it.
Remember Heavens? We're going around in a circle. Oh, it went on for so long that I.
I think that might be a good one just to maybe go back.
Board member Bennett, I don't have any.
Board member Riverman, only in jest did I say that, of course, so, thank you.
Remember Doyle on M? We were doing some wordsmithing back here
Yes,
and we were wondering if a briefer way to say it would be receive or transfer a prescription for a controlled substance orally.
I agree that sounds and as understood to a better degree. Yeah.
Board member Hammond, so you're gonna remove or
Give me just a second, please. Sorry. Just gonna type in. Okay. How's that? We need consensus on this. Just, yeah, should we have any?
board member Hammond's clarification on M. So they are allowed to do this as long as it's not orally.
Yeah.
Remember
Board
they-
member Hammond, this what is the rationale?
Federal law.
So Joanna Tucker Davis, just by way of history, previously and currently, in the current rules, pharmacy technician is prohibited from receiving or transferring prescriptions orally, period. And then at the last board meeting, the board determined at the meeting itself that they wanted to get rid of that prohibition and allow pharmacy technicians to accept and transfer prescriptions orally. The problem is, Ms. Davis went through, is that federal law prevents that for controlled substances. So there's a bigger policy call here about you could say that they don't transfer any or receive any prescriptions at all orally, but the decision the board made at the last time as a policy call was to allow oral receipt and transfer of prescriptions. But because of federal law, that policy call has to be tempered and not allowed for controlled substances. Just there's like a lot of prohibitions and back and forth going on here. Yeah.
Staff member Melvin, the sound quality was not great, so maybe suggested that we do go around again to get consensus on M as it's now been proposed. For the people on the phone, thank you.
Board member Doyle will be doing a round specifically for M. The new language is receive or transfer a prescription for a controlled substance orally. And your comments, up or down, so to speak, on that language.
Remember, Chin is fine with the language.
Member Hall,
Remember, Paul, I agree, yes.
board member Joyce agrees.
Remember, Viperman agreed up to the part where it says for controlled substance. I wanted to say receive or transfer a prescription.
Thank you.
So board member Hemmons, board member Viperman, you were saying that it should be for all prescriptions regardless of what's controlled or not. Okay, board member Hemmons, I'm fine with what it says. And I'm fine with what board member Viperman said also.
Board member Patel, I agree with M with this language.
Member Beeman,
Board Member Beeman, I prefer this language to the previous language.
remember Doyle, I prefer this language also.
Yeah.
We have concluded conversation for C.
I don't think so. I think you skipped me. I didn't make comment for prohibited practice. We stop at M.
I
thought we started. Yeah. No, I didn't make any comment.
Sorry, please.
Board member Hemmons, I thought we're just, I was confused because I thought we're just talking about M, period. So now we're talking about, if you have other comments, I heard that, I heard someone say, if you have other comments that's not about M, you can do so, which is what Viperman did. So then when it came to me, I thought I was supposed to comment if I had comments besides M. So it would be board member Patel's turn now to comment if she has any other comments on anything besides M. That was what I understood. I may be incorrect.
Anyway, so. Oh, right, board member Patel. So if you go back to the comment board member Viperman was making about supervise, direct and control another license in the practicing, if you can pull up that one. I agree with you, board member Viperman. The way I read it, that's what it's saying. Like you can't supervise, read rule and supervise another technician, you know? And that was in our rule for a long time. But to be honest with you, just like, earlier our counseling rule, right? Technician always offer counseling, even though it's not in our rule. Just like that, we have the rule that technician cannot supervise, but still most of the health system pharmacy, they have technician in the supervisory role. They do. Our current rule don't allow that. Okay? If you do here, we write down that exactly how I read it, that technician is not allowed in supervisory role. You can't supervise another technician because those technicians also assisting in the practice of pharmacy. Otherwise, why would you be there, right? You are there to assist the pharmacy.
Board member Hemmons, could we pull that up? That sentence?
Yes, do we have a line number? Sorry,
Yeah, 61.
So Staff Member Davis, I just think I want to add to the conversation in ORS 689-005, paren 31, which is again the definition of the practice of pharmacy. Paren K says the practice of pharmacy is the offering or performing of those acts, services, operations, or transactions necessary in the conduct, operation, management, and control of the pharmacy.
Board Member Clemens, I think it's the way it's worded, that's the issue.
This is Board Member Beeman. I agree with Board Member Hemmings. It's obviously just a confusion between the fact that the word supervise is used in statute, and then a position can be called a supervisor, though they are not supervising the practice of pharmacy. They are supervising their peers essentially in how to do that role within a pharmacy, which would be assisting. So I think it has sparked concern, especially reading the public comments, of just a confusion. And I don't know how to change it any better, because they're both appropriate uses of the word supervise and supervisor. But I think clearly our intent is that it is fine for a technician to oversee other technicians within the capacity of their license, not direct them or supervise them in the sense of practicing pharmacy, because they can't practice pharmacy per statute.
This is
Moment, please. So, for council, do you have any recommendations for language adjustment at this time before we take additional board comments?
So if I'm understanding the debate correctly, there are supervisors, as in I supervise your timesheets, right? Or I supervise to make sure you're showing up and work on time. A supervisory role in that sense is like a management role. This rule trying to capture that they can't supervise them in the substance of the work, right? In directing that in the actual substance, not supervised in the sense of, right, like there's like office managers for doctors. They're not supervising the medical care, right? They're supervising the non-medical HR stuff. I don't know. I've been thinking. So this rule is attempting to make sure it's talking about the practice and saying in the licensee practicing or assisting in the practice of pharmacy. I can't think of a better way to make sure it's clear that it's not about management, right? It's about the practice and assisting in the actual substantive practice.
Board Member Doyle, would it, yeah, I think that we're losing context of the second half of the sentence, and I don't know if reversing it with a comma would be helpful, or putting in while instead of in. So Staff Member Schnabel.
Staff Member Schnabel, I might have something on that. Was supervise, direct, or control a licensee or another licensee in activities that constitute the performance of the practice or assistance in the practice of pharmacy. So it limits it to specific activities that are considered the practice of pharmacy or assistance in the practice of pharmacy.
Remember Doyle, that sounds a little bit more explanatory, so to speak. Can Staff Member Melvin?
Yes, let me.
In real time.
No, it would have been another, inactivity.
Again, licensing out, just call it a practice. And then if it's all assisting in the practice. There it is.
Assisting. That's what we do. We assist. So we assist. If we take the assisting out, we are not, we don't want to, we want it to have it constitute the practice of pharmacy. We assist pharmacists. That's what we do.
Right, but the pharmacist is supposed to supervise that assisting.
Not you.
Yeah.
That's
You wanna read it?
But that is what the problem is.
But you. Remember, Jen, my understanding is that as a pharmacy tech, you cannot supervise the other tech in their assisting of that pharmacist. Only the pharmacist can supervise in the assistance of that. The assistance of pharmacy.
For example, if you're in an IV room and you're producing a compounded IV bag, you wouldn't be able to supervise another. You wouldn't be able to sign off another technician's work that it was compounded correctly.
That's not exactly true now, because we have to check that, but.
Not in compounding, you don't.
That's been rescinded.
Oh. Yeah,
Board Member Patel, now technician can do final verification.
okay, but so. If we. Okay, so this is my issue, is that we have taken every rule out of the technician rules. All the rules, this is what you can, this is what you can't do, which I did not want to ask. Now a technician who is 3 days old goes and looks in the book and says, this is the rules. This is what they're gonna read. And when they read supervised direct control, you cannot do that. They're gonna go, oh, I can't do that. She's doing something wrong, we're gonna have a problem. So that's why I think that it needs to be spelled out, because these are the technician rules. I want it to be clear for the technicians, not for a pharmacist. I mean,
Remember Doyle, I believe that we are doing our best to clarify what is and is not allowed and changing the language accordingly. And hopefully a new technician newly practicing is going to receive mentorship and guidance from other licensees while working to help scope this for them if they do have questions. Board Member Hall.
Member Hall. Yeah, I mean, tech supervisors in a hospital setting. Now they do, the IV room, they'll do sterility tests. They'll clean, it just feels like, they're supervising. Oh, it's confusing. Sorry. Yes.
Board Member Patel, you are absolutely right, and that's what Board Member Patel, that's what I was trying to tell you or everyone, that our rule, the current rule, and even our statute is that it's pharmacist supervise technician. We don't have that technician supervise pharmacist or another technician, okay? And you are right, that's what is in our rule too, that technician cannot supervise another licensing, but it's happening anyway in all the health system. Even they have the job description as a supervisor, like clinical technician, right, or clinical MTM. But then technician cannot have clinical judgment, right? So that's what I was saying, like, personally, I don't think so. We should strike out the whole sentence. No matter however you do, it's going to say prohibited practice that you cannot supervise in your license.
Member Chin,
Board Member Chin. My understanding is there are rules that supersede this, that make it, this rule needs to be there if you're doing just a list of prohibited practices. So somehow or other, there needs to be statement about a pharmacy tech is not allowed to do that is actually the practice of pharmacy or the assistance of the practice of pharmacy, correct? I don't think it, when we say as a board that it's already happening, so that must mean it's okay. Doesn't make sense if there are potential public outcomes because it's done that way. So on a previous board, we had, it's always been done that way, and we had to write rule. And as a healthcare system that I work with, had to change how we did our practices. And people were not allowed to do what we always did because it was really never allowed in the rule. So just because we do it doesn't mean it's correct. So I don't want to write rule or not write rule because what we do, it's what is correct.
This is Board Member Patel, and I agree. I'm neutral on this one. Okay, I'm neutral, but it's just like it does not make sense. Otherwise, that all the supervisory technician, they are at the violation of this rule. You know what I mean? So either we keep this rule and we hold everyone accountable, or we just don't have this rule. That's what I'm neutral on this one. But it does not make any sense that we have this one is rule and still we have so many supervisor technician in all the health system.
Are they, this is Board Member Chen, are they supervising in the act of, are they doing firm's job?
They are supervising another licensee, which is technician who is assisting in the pharmacy.
Staff Member Schnabel.
Staff Member Schnabel. Having spent 30 years in health system pharmacy as a supervisor, manager, and a director, we've always had a supervising pharmacy technician who supervised other technicians in all kinds of things unrelated to the practice of pharmacy or assisting in the practice of pharmacy. Do you come to work on time? Do you take 15-minute breaks? Do you follow the HR policies? The technicians in the hospital are supervised by pharmacists when they're assisting in the practice of pharmacy. There's never been a question in our hospital. I don't think there's ever been a question in any other hospital in this state that that is permissible. So this rule does not make that unpermissible suddenly. So I think as written, it seems rather clear.
This is Board Member Patel. So you are saying that supervisor technician who is supervising another licensee, which is technician, so those licensees don't assist in the practice of pharmacy?
They do. And when they're doing that, they're being supervised by the pharmacist that they're assisting. You can have more than one supervisor.
I'll give an example. That's what I have seen too. The sterility testing in the IV room. You know, that means you are supervising another licensee while they are making the IV. That's the part of the practicing pharmacist.
Was it, okay, so I just want, this is Joanna Tucker Davis. So 689, this is a statute, 689.486 specifically says a person licensed to perform the duties of a pharmacy technician may perform the duties of a pharmacy technician only under the supervision, direction, and control of a licensed pharmacist. I mean, that's the statute, and that's where I think this rule is trying to put in a prohibition language to get to. That the assisting in the practice of pharmacy can only happen by statute under the supervision, direction, and control of a licensed pharmacist.
So for clarity, an example is on the floor, sterility testing. A technician in the health system trains and monitors that another technician now adheres to the policies and procedures for said health system. And so I think the question is that supervision within the practice of pharmacy, does becoming a better learning the policies and procedures of the health system, the practice of pharmacy, or and if it is, it would still be okay because it is a pharmacist that's overseeing both of the technicians operating in that event. And so I think that I would contend that it's not the practice of pharmacy because you're not producing a product that eventually goes to the patient. You are evaluating that somebody has good technique. It's assuring that they are procedurally aware. And even if I am mistaken about that assessment, there is a pharmacist, or should be a pharmacist that is directing those two technicians to quote unquote work together to achieve that goal of training.
Board Member Joyce, I completely agree. Took the words right out of my mouth, and I've been in health systems for a long time. And that scenario, that's the perfect scenario to describe. I think we're conflating the word assisting beyond something that's patient specific. Because when we're talking about the practice of pharmacy, with it is patient specific, but when we're talking about assisting in the pharmacy, I mean, that could be, I could see that being conflated. So, but that was that was an example that I had in mind to bring up.
Member Doyle, are there other board members who haven't had an opportunity to talk about any part of this?
This is Board Member Beeman. I do see the concern in the way it's currently worded with the assistants, because that would cause confusion as to training and whatnot. My mind keeps going to something regarding independently, meaning outside the oversight of a pharmacist, because any type of training or a technician, I don't want to say advising, but helping another technician or training another technician in the task that they'll be responsible for doing, that happening in front of the pharmacist or being overseen by the pharmacist is I think more what we're talking about, rather than a technician independently helping or training another technician outside of the direction of a pharmacist. Thank you.
Member Doyle, I'm at a loss with how to move this forward or make a recommendation to staff, Member Davis, Staff Member Schnabel, Council.
Staff Member Schnabel, at some point, we need to reach a consensus on line 50 or line 61, sub M, which is hard to see. You could call the question and see if board members want to keep it, modify it, or remove it. And I think that's essentially where we may be.
call the question on specifically this line now, or?
Yeah.
Yeah.
Okay.
Um. I started, I would start next with staff, with board member Patel. With regard specifically to line 61, as has been amended. Do you agree with this to move it forward to rulemaking? This is not an official vote, but just get one line. Or do you have an additional change or omit it?
And this is board member Patel. As I say, I'm kind of neutral on this one, but if you want to keep this, then I don't think so. Technician can be supervisor. And if they want to be supervisor, then we should remove it. That's what I'm.
So how would you amend it? Board member Doyle, I am content with the language as is. I think that we've talked about it sufficiently well that the supervision and direction and control are only related to the technician in the practice of pharmacy and not other HR type issues. Board member Chin.
Board Member Chin, if you left it as it is in rule that constitute the practice of pharmacy and just put a period there. That also includes assisting in the practice of, they can't do what a pharmacist does. So if they can't supervise, direct, or control licensing activities that constitute what the pharmacist does, then would that suffice for stuff that's happening that is or isn't allowed by your? I'm just wondering if that fixes it. I mean, if it's a period, you can't do what pharmacist does, which is already rule and statute, and we're trying to put something in the rule that is already in statute. Does that address it?
Board member Doyle, I don't think so, because technicians can assist in the practice of pharmacy. So not.
Pharmacist doing?
Yes, but if it were to say supervise, direct, and control licensing activities that constitute the practice of pharmacy, then that would indicate that a technician could supervise, direct, and control a person, another technician who is assisting in the practice of pharmacy. If that second phrase is omitted. Member Hall.
Member Hall, what if we put, in the practice of pharmacies independently? And I'm a neutral, but that help if we just said that they can't do this independently.
This is board member Chen. I think if you put in the problem is that the techs who are managing can do that independently. They don't have to be a tech to do the management. They just happen to be the people who are doing the management. So there are two different roles that are getting confused in this statement.
Member Joyce.
Board member Joyce, the intent of the rule and the language, it seems clear to me, and assist in the practice of pharmacy. It seems clear to me. However, with all the confusion going on, I mean, I was just striking it.
This is Staff
I mean,
Member
it's
Davis.
clear to me, but it's causing a lot of confusion with everybody else. So just strike it.
This is Staff Member Davis. I just want to make sure you realize that if we were strike it, which you can do that, that doesn't allow the practice. I mean, it's still not statutorily permitted.
Right, like diagnosing.
Board Member Vipman. I'm not necessarily okay with striking it. I don't know why we just can't put a except where they are. They are.
We have created exclusions or clarification sentences and an idea is to put after practice of pharmacy period or to put or another, what would that be? P, I'm gonna be Q to B in. And it does not mean the human resources management of missions.
Staff member Schnabel, that does not flow with the lead in, unfortunately.
Let's look at that lead in.
Yeah.
Not good with striking it, because I don't think that a technician should directly supervise direct and control a licensee. However, I don't want to take that that managerial. It's not just managerial. It's not just the time card. It's the training, which is huge. And that's what I'm afraid of. I'm like, I mean, that is the pharmacist's job, is to make sure that the technician's trained. And who do you think is training the technician? The technician is. So if we, that is that you're supervising someone doing the stuff in the ID room, whatever. I want to limit that.
The thing quickly positive before I call on to the staff and other Schnabel is that we can leave it as is, and we're only potentially voting this to go to rulemaking hearing, and we can get comment back, and maybe somebody else outside the board has better language that they could use.
I think that's a great idea. Thank you.
Staff member Schnabel, I think this was said once before, but training is not the practice of pharmacists per se. So that training would not be included in that statement.
This is Board Member Beeman. The assistance in the practice of pharmacy is what makes me concerned with the training piece. The way it's phrased with that piece in there is it makes it sound like a technician. I should say, I could see how a person reading this would say, well, a technician can't train another technician because they're training them on the duties that constitute assisting in the practice of pharmacy.
Staff member Schnabel, which is not assisting in the practice of pharmacy. So
Right.
I guess we're kind of going circular here.
I know it's really hard.
And we can put something to the effect of parentheses, not to include training.
Eugene?
And it's staff member Evans, board member Evans, I apologize.
Board member Hammond, just an observation. I think the terminology practice of pharmacy is a term in of itself, which has a specific distinction. And I think it's hard to look at this and remember that when it says practice of pharmacy, it really refers to that specific distinction. Question, who is this written for? Who's the audience of this?
Citizens of the board.
Right, so the technician understand that that's a very distinct distinction, practice of pharmacy. What that definition is as it relates to definitions within Board of Pharmacy. I think if you understood that, then it's not an issue.
Member Doyle, they would be trained by their other technicians and pharmacists what constitutes the practice of pharmacy. They would be told what they can and cannot do.
But if you think about just as a lay person, it's practice of pharmacy has a very distinct definition, correct?
Correct.
I think that's what the problem is in the way this is framed. I could see how someone says assistant in the practice of pharmacy means anything that you do within in a pharmacy setting, right? Would not be allowed and supervised, right? But if you understood and if there was a practice of pharmacy as a very specific meaning, then you wouldn't make that assumption. So my question is there enough? This practice of pharmacy is what the issue is. If you had a way of defining what that was within the sentence, I think that would probably be helpful. I get it. I understand what it means.
Remember Doyle, the lead in for this whole thing is engaged in the practice of pharmacy as defined as ORS 689. So there was a reference made at the beginning where a practice of pharmacy definition can be found.
I'm gonna go back up to that.
That's
Oh, I know. We're intellects, a lot of us, and deep, but I mean, honestly, who's gonna go back to look that up? Oh, what does a patent? You're gonna read it and you're gonna read it as as it is. You're not gonna go back and, oh, what does that word? Those are three different words, but it actually has a very distinct meaning. And we could understand that, right? But I think it's problematic without actually having what that definition is. The practice of pharmacy is not just the practice of pharmacy. The practice of pharmacy has a very distinct definition in the board.
Remember Doyle, would there be any objection to moving this item as written as such to rulemaking hearing and seeing what comments we get back without making any additional changes?
Board Member Chen, I would not have any objection, but in just the question back to Board Member Hammond. I think that when you are trained as a pharmacy tech and you have to have training, and you have more training if you're a certified pharmacy technician. First thing you learn is a pharmacy. That's ingrained. I don't think that there's gonna be for a licensee, if they've had their training, question about what the practice of pharmacy is. That's my thought.
I think I read, thank you, Board Member Hennis. I think I read in some of the comments section about this issue of supervising pharmacy techs being able to supervise each other. So I think obviously there's some confusion around it. And I think it's the practice of pharmacy.
Board Member Doyle, I question whether or not we are making it more difficult for ourselves and that there might not be as much confusion as in the in the domains that staff member Schnabel had mentioned, so again, that's one of the reasons why I'm suggesting to manage our time, to send this to rulemaking with the statement as it is, and then see what additional feedback or recommendations we get, and we'd be able to make those changes in December.
It doesn't matter to me. I mean, I understand what it means. I'm just trying to. Not talking. Oh, sorry. I'm fine with the way it is, because I understand exactly what it says. I was just trying to help figure out why it might be an issue.
Or any objections to a suggestion? So I believe we're at the conclusion of talking about this rule. Am I misunderstanding anything from anybody? So we will vote on this tomorrow.
I'm sorry.
Board Member Herman.
Board Member Simmons, is it possible to actually write out what the practice of pharmacy is rather than say practice of pharmacy?
This is Joanna Tucker Davis. The difficulty is, I don't know if we can bring it up, if the practice of pharmacy is defined in 689-005 and it's long. That's, I think, great.
You put the ORS there, the.
Yeah.
It's cited.
The ORS there.
Cited.
It's A through O. There's that many different things that it constitutes, but
Just enough, that's a thought.
yeah,
We could.
we could refer to statute ORS 689.005. As defined in practice of pharmacy as defined in 689.005.
That might be helpful.
Are you saying you wanted in one or actually in N? Just.
Board Member Simmons, or not to be confused with
I would put
managerial,
practice of
you
pharmacy.
know, HR related provision type work, something like that.
Let's do the practice of pharmacy as defined, not the second one, the first one.
Right.
All the plans, you know, the range or just.
No, it's a-
Okay.
Thank you. We have consensus on moving this forward, and an official vote will be taken tomorrow. Staff Member Davis, if you're still on the other end of the line, shall we be tackling C1?
Oh, no. How much time do we, what time do you plan to end today?
What we will go as long as the room will allow us. Do we have to be out at 4:45?
The meeting could go till 4:45. We have to be out of the room and clear by 5.
Hearing that we have 20 minutes, Staff Davis, what's your need or suggestion?
I have 2 different rule mailings that we could look at, that I've estimated in total would take 30 minutes. So why don't we do the first one, see how quick it goes, and then we'll tackle the second one. Actually, let's just do the first one. Because I don't think this will take.
Which one?
a
This
long
is
time.
board member Patel,
C5.
what's Davis? What staff Davis?
What?
Do you hear me?
Yes,
This is board member Patel.
okay.
So, sorry, I wanted to go back on C9, if we have a little bit time. So C9 on the 855-115-0001 applicability. And the section 3, when you add that highlighted portion, and I was keep reading 2-3 times. And now I know what was missing. So if you can clarify, does our intent for that one to exclude the central processing? Because if you add that yellow portion, what that mean, like, you cannot do central processing for the prescription. If you want to do central processing, that means those pharmacist has to be Oregon licensed. That was our intent. Because without yellow, it totally makes sense. Without highlighted portion, it totally makes sense. It's perfect, good. If you add that highlighted portion, then it says a pharmacist who is gone.
Give me just a moment.
Thank
The
you.
public could not see what you were talking.
Perfect, thank you. You know what I mean? But if you add that, a pharmacist who is providing other pharmacy service into Oregon must be licensed in Oregon. To me, that means central processing pharmacist, they have to be licensed in Oregon. That is our intent, or that's not our intent?
The central fill pharmacist is working from a registered drug outlet and would be part of the exception.
They will be. Okay.
Or they do not need to be licensed.
Thank you for clarification.
What is your direction, staff member Davis?
Let's do mailing C5. This is Schedule 2 prescription requirements.
All right.
Okay. So this is the board's first review of proposed rule language for the revision of rules to add items that a pharmacist may change on a Schedule 2 prescription. The board will consider sending the proposed rules to November 2023 rulemaking hearing to potentially adopt in December 2023 to be effective upon adoption. So a little history here. This is quite the fun research I got to do on this one. So in 2019, there was a presidential executive order that required all federal agencies to review and consolidate various informal guidance documents. As a result of the review, the Drug Enforcement Administration, or DEA, removed informal guidance on its website that concerned changes to Schedule 2 prescriptions. Compliance officers on phone duty are frequently receiving inquiries on what state regulations or board policy is concerning the changes that a pharmacist can make to a Schedule 2 prescription in consultation with the prescriber. We have no current regulations or board policies concerning this matter. So I went back and I looked on the web, and starting 10/18/2022, the DEA updated their frequently asked questions, which is one of their informal guidance documents, and directed pharmacists to follow state regulations. So the exact language of the FAQ reads, question, what changes can be made to a Schedule 2 paper prescription? And answer, in the past few months, the DEA has received an increasing number of questions concerning pharmacists' ability to add or modify information, like a patient's address on paper prescriptions. To address these questions, the DEA has been reviewing the relevant regulations and working to draft new regulations to address the issue. In the interim, pharmacists should adhere to state regulations or policy regarding those changes that a pharmacist may make to a Schedule 2 prescription after oral consultation with the prescriber. So, the draft rules that we've proposed today are modeled after what was the DEA's historical responses to this FAQ. They used to have it listed out what you could change. And looking at other state regulations and board policies on the matter. So, for example, one of the previous DEA FAQs, when asked the same question, what changes can a pharmacist make? The answer used to be in 2003, the pharmacist may add the patient's address or change the patient's address upon verification. The pharmacist may change or add the dosage form, drug strength, drug quantity, directions for use, or issue date only after consultation with an agreement of the prescribing practitioner. Such consultations and corresponding changes should be noted on the prescription as well as the patient's medical record. Pharmacists and practitioners must comply with state and local laws, regulations, or policies prohibiting any of these changes to controlled substance prescriptions. And it kind of went on to talk about different things. it said in the end, the pharmacist is never permitted to make changes to the patient's name, the controlled substance prescribed, except for generic substitution, or the prescriber's signature. So staff believe that basing these draft rules on previous DEA guidance will make it easy for pharmacists to comply, as this was the standard of practice for many years. So the language that we're proposing today would be adding into our controlled substances division under the rule 855-080-0085 paren 4. The new rule will say for Schedule 2 controlled substance prescription, a pharmacist may, paren A, add the patient's address based on information provided by the patient or patient's agent with appropriate verification. Paren B, amend or add the following information after consultation and agreement of the prescriber. Large A, drug strength, B, dosage form, C, drug quantity, D, directions for use, F, prescriber's address, and G, prescriber's DEA registration number. Paren C, they may amend the following information after consultation with and agreement of the prescriber. The paren A, date the prescription was issued, and paren B, the date the prescription can be filled. Paren D, for B and C, the pharmacist must document on the prescription the date and time of the prescriber's authorization, the amendment or addition authorized, and the pharmacist identity. Paren 5, for Schedule 2 controlled substance prescription, a pharmacist must not change the patient's name, the controlled substance prescribed, except for generic substitution, and the name or signature of the prescriber. Board staff would like board member input on these proposed rules that closely model the DEA's previous informal guidance. Back to you, Board President Doyle.
President Doyle, thank you. We'll do a round robin to collect germane comments with regards to the proposed changes. Board Member Patel.
Board Member Patel, I do not have any comments on this one.
Board Member Doyle, happen to be involved in this part of pharmacy law at my employer, and this seems all very appropriate and I think good for pharmacists in Oregon to better understand. And I recall that seeing on weekly updates provided by Executive Director Schnabel that there have been questions about this issue coming into the board. So I think this will be helpful. Board Member Chin.
Member Chin, comfortable as written.
Member Hall.
Member Hall, yeah, I'm fine with everything that's written.
Member Joyce.
Barbara Joyce, yes, it's all encompassing and detailed and looks good.
Member Vipperman.
Member Vipperman, yes, this will help a lot of pharmacists know what they can and can't do. I wonder about the changing of a prescriber's DEA registration number. You don't have a problem with that, them being able to change that? The DEA number, if the DEA number is written, you don't have a problem with them changing that? Why would they need to change that?
This is Board Member Chin. It says amend or add the following. Sometimes,
I understand,
they don't have sometimes people don't put their DEA on there.
I understand that.
Sometimes people write it wrong.
I just don't know if, I'm comfortable with them changing it.
This Board Member Patel, and another time I have seen that when you are in hospital, you have attending, and then that resident, their DEA number is not in the system. So we have to put that attending DEA, right?
This is Board Member Chin. There's a full ball of worms with.
Yes, yeah.
All DEA,
Yeah, and that's the time we have to add the attending DEA because that resident DEA It's either it's not registered, it's just not in your system, and attending say like, yeah, I'm supervisor, you can put my DEA. We get okay, so that's another time we get.
Board member,
My comment.
thank you.
What are the limits, no problem?
Thank you. It appears that we are not offering any specific suggestions at this time.
Board member Beeman, did you get
This
to
is
speak?
board member
Sorry.
Beeman. Oh, thank you for this. I used to use that document all the time. To the point I can still see it in my photographic memory of thank you. This is so clear. The one thing I want to clarify is drug. If you can scroll down, please, it's drug name, which no, you can't change the drug name, but there are times that a prescriber, specifically in handwritten prescriptions, they will put, say, hydrocodone 5325, and they do not include the acetaminophen component. So for drugs that have like two components to them, I want to make sure we aren't viewing that, because we're I mean, I just want to make sure we're very clear on if they clarified with the prescriber and amended to say, based on the strength indicated, the correct version of the drug, that they wouldn't be in violation of this, or make it very clear that no, it has to be the exact drug, because that is the one place that even when this document was available, there was kind of a gray area of they're intending a hydrocodone acetaminophen tablet. They only wrote one of the two names of the drugs. You're not technically changing the drug from hydrocodone to another medication. So that's the one kind of area that I just want to make sure that if everyone's clear on it, and it's only my experience that was an issue, I'm completely fine with this as it is, but I just want to make sure that changing the drug is that we are meaning it changing from absolutely one drug to absolutely another, and not allowing a strength issue to kind of convolute that.
Staff member Davis, staff member Melvin, can you scroll down?
Looking for it.
Line 64, you can't change the controlled substance prescribed. So you could add
Okay.
acetaminophen or you could add ibuprofen. You just couldn't change it from hydrocodone to oxycodone.
Thank you. Thank you. And that actually is the answer that I wanted, and I just didn't read it. I just read it as controlled substance, i.e. Percocet is a controlled substance, as is Norco brand name. They're both controlled substances, but they are broken down into two separate drugs. And I know that's just kind of off in the weeds, but when you're in the pharmacy feeling and it comes up, you get a little, you go off in the weeds, like, am I doing the right thing? So I appreciate that clarification, and I'm really grateful for this being in there. Thank you.
Staff member Davis, any further information required from us?
Nope, that was all. Do you want to try for one more?
5 minutes.
This one's pretty straightforward, so it would be C7.
5 minutes.
Go ahead.
Give me just a second to pull it up. C7, sorry.
Yeah.
Start letters, okay. Oh yeah, is this the right one?
C7, pharmacist supervision.
In 5 minutes?
Yeah.
Give me a second.
I promise you. Well, I had 10, but that last one went really fast, so I feel that the board will, if we do need to have a lot of discussion, we can just table it and pick it up tomorrow. It's totally fine. So this is the board's first review of proposed rule language related to supervision of interns, COPTs, and PTs. The rule is to clarify the limits for supervisions of interns, COPTs, and PTs. A similar rule was already adopted that will be effective 3/1/2024 concerning the supervision of interns by a preceptor. And then the board will consider sending this to November rulemaking to potentially adopt in December 2023 and to be effective with the new licensee rules on 3/1. So when the board discussed the intern rules during the June 2023 board meeting, the board indicated that a similar rule to OAR 855-120-1122, which is the responsibilities for supervision by a preceptor, should have been added to the new pharmacist rules. We failed to do this in real time during the June 2023 board meeting. So board staff proposed this rule just to fulfill the board's direction as it complements the rules for preceptors that is already on the books effective in March. So the rule will read 855-115-0122. When supervising a certified organ pharmacy technician or pharmacy technician, each pharmacist may supervise as many certified organ pharmacy technicians or pharmacy technicians as they believe in their reasonable professional judgment is appropriate to protect and to promote and protect patient health, safety, and welfare. And then in paren 2, this is the same language as what's already been adopted for preceptors. When supervising an intern, each pharmacist may supervise no more than 4 interns participating in direct patient care activities. Paren B, as many interns as they believe in their reasonable professional judgment is appropriate to promote and protect public health, safety, and welfare for interns participating in non-direct patient care activities such as informal health fairs that provide general information but not patient-specific information. And back to you, Board President Doyle.
Board Member Doyle, this is adding greater clarity to apply to pharmacists, even though they might not have a preceptor license. No further comment, it's fine. Board Member Chin.
Member Chin is fine as written.
Member Hall.
Member Hall, fine with what's written.
Member Joyce. Member Joyce looks good.
Member Bipperman, so this is not new language in the technician part, correct? I just wanted to make sure that was true. No, I'm good with this.
Member
Member Hammond, I don't know.
Patel.
Board Member Patel, I particularly don't like line 21. I think we should leave that up to the pharmacist, but I can deal with it, sure.
Member Beeman.
Board Member Beeman, I'm comfortable with it.
You that closes discussion on C7. Take that as a clue to call it a day. We'll be working the agenda to determine the best course of action for tomorrow for the sequencing of items, and again the package C items that we discussed today we'll be voting on at some point tomorrow. Thank you, and
Okay. All right, staff member, motion to adjourn. Page 16.
I board member move to adjourn at 4:44 p.m. Vice President Chin,
Second.
Member Beeman,
Board Member Beeman, yes.
Member Hall,
Member Hall, yes.
Member Evans,
Member Hammond, yes.
Member Joyce. Member Joyce, yes. Member Patel,
Yes.
Member Zimmerman.
Yes.
We are adjourned. And we'll see you tomorrow on Friday, the 13th.
Lucky day.